Hello, this is Dr. Leela Krishna, consultant urologist at Asian Institute of Nephrology and Urology, High Tech City. What are the causes for frequent urination? Most of the patients usually come to the hospital saying sir, I get frequently passing of urine within an hour 2 to 3 times, or hourly once, or in the night time 2 to 3 times. So we need to decide what is the cause for it. If a patient presents of younger age group who presents to us with these complaints, you need to get evaluated with routine investigations, with complete blood picture, and you need to do a ultrasound abdomen as well as urine routine and urine culture. At the same time, if the reports seem to be normal, you need to be continuing with a rectal examination and to rule out acute prostatitis. If it is of a middle age group, you need to rule out symptoms related to prostate. And as well as during routine evaluation, you need to see for the symptoms, associated symptoms like any back pain, any blood in the urine, any history of any malignancies in the family, or any other issues. And coming to the examination part, you should be very careful in examining the patient to know the cause. From whether the patient is able to retract the foreskin of the penis, whether his urine flow was good, or related symptoms and abdomen should be examination should be complete, and we should be able to decide what was the cause for it, whether it can be due to acute prostatitis, or in a older age group it can be due to benign prostatic hyperplasia, or it can be due to kidney stones, or it can be due to any other cause. And associated symptoms like blood in the urine or any other burning maturation or any other symptoms, you should be able to rule out. Now, first, burning maturation as well as the associated symptoms we can able to find the actual cause which is leading to this. First, it can be due to kidney stones, in which the stones can be in the kidney or within the ureter, which they call it as ureteric stones, or within the bladder, they call it as bladder stones. Whereas in bladder, you might have finding a small tumor which is called as urinary bladder tumors, which can be a benign or as well as malignant, which can also be a very suspicious thing to follow up. And the other things we should be aware of was the routine examination, which includes complete blood picture, which shows how is your hemoglobin level, the WBC count, as well as the platelets. Whereas in the renal function test, you should be able to know the renal function test, the urea and the creatinine, urine routine and urine culture. Urine routine will be able to show what are amount of pus cells, epithelial cells, the sugars, the protein level, everything in the urine can be found. Whereas in the urine culture, we'll be able to know the organism which is responsible for any urinary tract infections. The urinary tract infections are more common in females than in males, because the motion passage as well as the bladder as well as the birth passage was very much close in approximation to each. They have higher chance of urinary tract infections. So what are the precautions to be taken for the females? We need to know what were the precipitating factors which are leading to recurrent urinary tract infections. So it can be a constipation or inadequate hygiene and other things we should be able to know. So in this urine culture test will be very much helpful to us in knowing what is the organism and what is the appropriate antibiotics to be given. And if the patient having any other precipitating factors like constipation or any other thing, should be treated adequately to clear this urinary tract infections. And if it is burning maturation or frequent urination, it can be due to other causes like any bladder neck elevation or any bladder abnormalities in which the bladder capacity is very much less. They might have frequent urination, in which it can be due to genitourinary tuberculosis or in other conditions like hypotonic bladder or overactive bladder. In these conditions, we should be able to do a urodynamic test and know what are the appropriate medications responsible for the treatment. And the other medications, what if it is an overactive bladder or hypotonic bladder, you need to do a urodynamic test and use the appropriate medications. If it is for symptoms of the prostate, you should do the appropriate uroflow, ultrasound, and parectal examination, and to know what are the patient symptoms, whether to go it conservatively with medications or to opt for a surgery. There are different multiple factors to decide on the patient's treatment. Thank you.